Global Spine Outreach is a 501c3 nonprofit. Our volunteers treat children with severe spinal deformities around the world and train surgeons to treat their own patients year-round. We believe no child should die or be paralyzed from a treatable spinal condition such as scoliosis.
We're going to make him taller. ¿Estás listo? Necesita la cirugía, es mucho mejor. Va a crecer mucho en un día. ¿Está bien?
¿Un día?
Sí.
Un día.
Es un buen día, sí.
What we do is a very precious thing, and that is really we're preserving life. And these kids without treatment almost certainly would succumb to their illness at some point far sooner than they would if they had treatment.
They are often even struggling at a young age to do basic things such as walk and breathe and enjoy life, and you can just sense that.
For a lot of children, we're providing surgery just to allow them to breathe. Because if they can't breathe, they don't grow and they just deteriorate and wither away. But we let them breathe, and then all of a sudden you see them gain a lot of weight and they look healthy and they can heal their wounds now.
And that's really what we're trying to do. We're trying to prolong not only their chronologic life, but also the quality of life that they get to spend here on Earth.
So we go way out of our way to make sure we speak to them, they understand what we're doing. We're providing gold standard United States level care all over the world.
What we see here that's a little bit different though is how advanced these pathologies are. So oftentimes these kids go untreated for so long, so the time that we get to intervene on behalf of them is probably delayed by several years compared to what we have in the United States.
You see these children come in ones that have been followed, some for 8 to 10 years. They wear their Sunday best. They wait all day long. They may have traveled 3 or 4 days to get here, and they're literally excited to see the doctors.
And a lot of these kids are coming from neighboring communities or even traveling hundreds of miles to get to see us. And the sacrifice that these families are making to have their kids cared for is tremendous. And that includes families with tremendous financial hardships, families that have emotional hardships, or families that have disabilities in and of themselves, and they don't want to pass that disability down to their kids. You know, trying to give their kids a better hope and a better future. Things that they cannot do unless the specialized care that we're able to provide with Global Spine Outreach is available to them.
We now know there are some cases that were just abandoned, and they were just, you just have to learn to live with this problem. And now we know that we can help them. And we see these kids that have come from different parts of Colombia already neglected by other physicians that said there's not surgical possibility to do anything. And we have fixed them. At least I think I've helped. And then see them year after year grow up with the spine fixed. Maybe not 100%, but enough for them to play and to live a normal life.
My little girl was born on December 25th of 2001. It was my best Christmas present ever. As time went by, I started to see that my little girl started deteriorating her spine. The first doctors that saw my daughter, they started telling her that she will never walk, that she will always have to wear diapers, but she proved them wrong. Thanks to God, the doors opened to myself, and I was able to reach out to the foundation Casa Colombia. There the doctors saw what she had, they evaluated her, and they gave her the date for the surgery in November of 2004.
Ana Maria was a real challenge because she is a very normal girl with congenital scoliosis, namely all the bones are triangles instead of rectangles. And we found a piece of bone going right through her spinal cord. We removed that 10 years ago.
From that day on, the life of my little girl started to change. Her quality of life started to evolve and be better and better each day.
Year after year, I did, I think, all of her surgeries, 12, and then she becomes a Taekwondo champion.
Cheers, parades, represent
these surgeries that we have done in all these 15 years, 24 spine trips, they are the most complex spine surgeries that you can think of. So I think in each week we do about 10 to 15 cases. So each week, each case has a lesson to learn, and they are so complex that before I thought that they couldn't be done. And seeing these doctors doing them and we helping them, well, it gives us the confidence.
My name is Jose Alberto Rodriguez. I'm an orthopedic surgery resident. I'm here to volunteer and help out the team during this trip. I think I've learned a lot about spine surgery in these, 5-6 days that I've learned in my residency so far. He went through me and he taught me, and he went through the procedure and guided me, and they were successful, and it's an amazing experience. It gives you motivation. Certainly as a young surgeon, it gives you motivation. You see the progression of the results of the hard work that you do, and that's why you get into this field, and that's why you study day and night to make that happen for a child in the future.
The best way to teach is hands-on on patients, not just watching from afar or reading it in a book. And global outreach, I think, is the strongest way to achieve that goal.
It's very exciting to see that the local doctors are growing along with us in terms of their experience, in terms of their ability to do more and more challenging cases. And the whole idea behind the Outreach Foundation is sustainability of that mission.
And it goes back to the point where you can obviously fish for someone and provide them fish, or you can teach them how to fish so they can provide it for themselves, and that's obviously a much better educational model. So that's actually, to me, even more gratifying than the individual patients we help.
One of my dreams is for every spine doctor to go on a trip like this once. And I figure a percentage will catch the bug and want to come again. That's what happened to me and everybody who's come back more than one time. You realize that this is the most important thing. More and more we're bringing some of the most senior and famous surgeons around the world, and now all of a sudden groups come and we have symposiums, and we're really using global outreach as a platform to emphasize different techniques, but also emphasize safety, because sometimes that gets left behind. Her C1 moves in front of C2 and then narrows the space for the nerves in the back. That may be why she can't walk.